Hamilton County is now at a low risk for transmission of COVID after months of uncertainty. The CDC recently made the announcement, and Local 3's Dallas Payton spoke with an infectious disease specialist to learn what the change means for our community. Dallas.
Cindy, this means restriction recommendations are much more relaxed. Dr. Mark Anderson with CHI Memorial told me he's happy that we have somewhat of a break from COVID outbreaks.
Our numbers are really low. They're down in the single digits for both people with active COVID who are in quarantine, and also people that are still in the hospital because of complications of COVID. They were so ill that they've not been able to safely go home. So that both of those numbers are down at the lowest point we've seen them since 2020.
Dr. Anderson says numbers have dropped consistently for the past 2 to 3 weeks. The low rates have eased the hospital environment.
It has lessened the stress and tension that surrounds COVID. It's enabled us to focus more on all the other stuff that we need to do in healthcare. We've been doing that all along. We never had to stop, but it made it harder.
He knew this day would come eventually, but it was hard to predict exactly when.
Because this virus has really thrown us a lot of curveballs. At one point I was telling people that I'm limiting my predictions on what COVID's going to do to 15 minutes because it was becoming obviously an exaggeration.
Although Hamilton County is now a low-risk area for COVID, Dr. Anderson says it's not time to do away with masks just yet.
I think that people who are immune suppressed, who might not have responded well to the vaccine, so that's people who are on chemotherapy for cancer, who have had transplants, or just have really severe heart and lung disease. They probably should be in mask at all times when they're out in public around people they don't know.
Others should be good inside and outside around people who are vaccinated. The CDC recommends that unvaccinated people continue to wear a mask. The CDC still recommends you stay up to date with their COVID vaccines and get tested if you have symptoms. In studio for Local 3 News, I'm Dallas Payton.